So good evening and welcome to Edu Skills OET Made Easy. Our mission is to make you fall in love with OET. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work and share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. And today we are going to deal with reading again. And let me share my screen without much intro. At YouTube, please let me know if you can see my screen. And am I audible and visible? Yes. Yeah, just type in if my screen is visible at YouTube. Yes, Father, yes. Reading skills. Everybody is interested in reading, so we are going on doing reading, guys. And I have to stop once. There is a technical issue. I have not put in focus mode. Yes. Now it's fine. Yes. Visible, right?
Yes, Father.
Audible and visible at YouTube. Right, this was the text that was being a cause of a lot of misunderstanding among you. Okay, let's fight it first. I doubt the authenticity of the text. And one clue for you to know whether a material is authentic or not, if that has no answer key, that is definitely not authentic material. Okay, authentic materials will always have answer key. So don't use any material without answer key. So if you don't send anything in the platform for discussions without the answer key, okay, send it along with the answer key. Sorry. I'm trying to bring it to highlight mode. Yes. Oh, there is. It's teaching me patience and teaching you patience, right? Right. So we are here. A patient surrogate can make decision. What is a hedging word or keywords? This is known as the question stem. This portion is known as the question stem. Yeah.
Surrogate.
Yeah. What is the hedging word in the question stem?
Make decision.
Patient, surrogate.
Make decision. Okay. Then option A, even when the patient is conscious.
Conscious.
Conscious. Only when the patient is unconscious.
Unconscious.
Okay. So option C, when the patient has previously expressed preference.
Previously.
Okay. Anything else?
Only the absolute.
Yeah. In the Zoom classroom, if you have any distractions at the background, please don't interact. Okay. There is some instrument which is making a sound. Please don't unmute. Only those who have no distractions in the room where you are sitting, you can interact. Others can just put in the okay, typing in the YouTube comment space. Yes, I'm looking at it. Great. Yeah. Anything else you want to highlight?
Conscious,
Only.
unconscious. Direct opposite is.
Direct opposites.
Father.
Okay, conscious and unconscious is direct opposite. So what is the principle?
Other
One of which
the other one
is the
is
answer.
eliminated.
Other one is
Eliminate.
eliminated. Okay. Now, next. Anything else?
Absolute in
No,
B.
only
Absolute.
means
Only.
absolute, Father.
Only absolute.
It's only absolute.
Only when. No.
Only when the
Only
patient is
when-
unconscious. The nursing staff can rest, go to the restroom when the patient is unconscious. Does it only mean 0 or 100? Only when you are happy, you can practice OET. Is it 0
No.
or 100?
No.
No, Father.
I'm telling you, only when you're happy and comfortable and joyful, practice OET subtest. Is my only mean 0 never practice or always practice? Come on at YouTube comment space. Did I say never practice OET
Not
or
0.
always practice OET?
Not 0 and not 100.
If it is not 0 and not 100, it cannot be absolute, right?
Absolute.
So there was a discussion going on telling that it's an absolute. I'll explain to you again. The exceptions in absolute I have already explained. This exception says even if the absolute word is used, the meaning must be
Absolute.
absolute. Here, do you think the meaning is absolute?
No.
No, it's not. When I say, that's why I gave you another example. Only when you are comfortable and happy, practice OET subtest. That doesn't mean always you have to practice OET subtest or never practice OET subtest, correct?
Yes, sir.
Yeah. Let's, if somebody is interested to read this paragraph, let's see. Now, this is definitely eliminated because conscious and unconscious are straight opposites. One of them must be the right answer. So you have made it very easy. Now you have only 2 options. You have to find out which option is correct. Yeah, please. Anyone.
A surrogate decision maker is the
Please.
individual legally authorized to make decisions on behalf of the patient. The goal of surrogate decision making is to reflect what the individual would have decided if able to speak for him or herself. This substitute judgment is used when the patient has previously expressed preferences, or when the surrogate can reasonably infer what that patient would want. When the patient's preferences are unknown or unclear, then the surrogate decision maker should make decisions based on their determination of the patient's best interests. Any healthcare surrogate agent is granted the same rights in regard to access of medical information and decision making as would the alert and competent patient. These rights remain until such time as the client regains decisional capacity, a guardian is appointed, or the patient's death occurs.
Okay. Now, any idea anywhere? When should we make conscious or an unconscious? What is the goal of surrogate
Unconscious.
decision making?
To reflect what individual would have decided.
What the individual have decided if able to speak himself or herself, right?
Yes, sir.
That's the purpose. Any other sentence telling you some idea about any of A or B option?
The next sentence, but it is judgment, not the decision, sir.
Which one? Next sentence is substitute judgment. Yeah, judgment
Yes.
and decision are synonyms. Don't worry, they are synonyms.
Okay, then
Decision maker
substitute
should
that-
make decision based on the determination of the patient's best interest.
best interest should make. Okay. Surrogate decision should make. No, they are not asking only conscious when they are asking only of the situation of the condition of the patient. When he is conscious,
These rights remain until such time as the client regains decisional capacity. A guardian is appointed for.
Okay,
Death.
that also gives some
Or
clue,
the
right?
death of.
Yeah, and then also they are concluding with some clue. What about the third option? This substitute judgment is used when the patient has previously expressed preferences.
Then
Or
the
when
answer
the
would be
surrogate
this.
can, pardon? Come on.
Then this substitute judgment is used when the patient has previously expressed preferences. Means if unconscious, the patient is on unconscious state also,
Yeah.
we can consider that. So it fixes the statement of B. B is the right answer.
Third one. Let's see. Don't worry. Your mistakes are my syllabus, so don't worry making mistakes, no issue at all. This is not a very authentic material, however, since you are discussing on it, let's apply all the strategies here. Now, this is saying this substitute judgment means making decision. Judgment means be decision. Is used when the patient has previously expressed preferences or when the surrogate can reasonably infer that the patient would want. Means, I can read another way. This substitute judgment is used when the patient has previously expressed preferences or when not expressed preferences. So this third one is not correct. Even if they have not expressed preferences, when the surrogate can reasonably infer means just think, okay, this should be the interest of that patient. When the patient has not expressed preference. So that cannot be the third option, cannot be the answer, right? Because it says,
Yes,
even when expressed or not expressed, they can make decisions. So third one is not correct. Now, conscious or unconscious?
The topic sentence decision on behalf of the patient.
On behalf of the patient. That doesn't mean I am saying this is not very authentic. That doesn't mean he is authorized to make decisions on behalf of the patient. That may not mean the patient is unconscious, right? Even if sometimes patient is conscious but cannot speak, right? There are situations. Don't you think a patient who met with an accident and a lot of injuries in the mouth, not able to speak, but is very conscious? You have plastered the mouth. What do you say? Come on.
A is the answer for that because when the patient is preferences are unknown or unclear, the surrogate decision should make the decision based on the determination of patient's best interest.
When the patient's preferences are unknown or unclear, then the surrogate decision maker should make decisions based on the determination of the patient's best interests. Does any of the options speak about the interests of the patient?
no, Father.
Normally, when do they have a surrogate decision maker? In general sense, when the patient is not able to make a decision, so it must be unconscious, right? When he is conscious and competent to speak, the patient will speak, right? Yeah.
Yes, patient can make the decision.
Somebody wanted to say something else. Some male voice was.
Sir, generally speaking, sir, when the patient is conscious, he can make the decisions, right, sir?
Yeah.
Surrogate usually when the patient is unconscious, only you have to take this. So that is the.
Yeah, that is the thing. But only thing here, what it says, even when the patient is conscious or unconscious, even when the patient means something else, right? So we can't agree with that. Even when patient. Did you get me?
Yes, Father.
Yes, Father.
Yeah, so
Even means even it
even
can
when
be
the patient
conscious
is
or
conscious.
unconscious.
Yes, Father. Yes.
Yeah, it means something. So only when the patient is unconscious. So only is not an absolute. You should understand the meaning of the sentence. Only using a absolute word will not make the sentence absolute. Okay? Only when the word is not in motion, the nurses should take rest. Doesn't mean you should never take rest or you should always take rest. Neither 100 nor 0. Is that clear?
Yes, sir.
Any doubts you can raise, no problem.
No.
Those who are involved in the discussion in the platform.
Can you please elaborate more?
Here you see, the patient surrogate can make a decision. Patient surrogate, you can think of a person, guardian, or whoever's attender, what you call? Attender, right? Patient's attender, normal language?
Attender.
Attender, okay. Patient's attender, maybe his father or partner, life partner or son or whatever. So when can they make decision is the issue. Okay. Now, they are giving 3 options. Even when the patient is conscious, or even when means conscious, unconscious, all situations. Even when the patient is conscious means even when the patient is unconscious. Okay. Even when. Okay. Even if she is conscious, you can make decision. Means definitely when it's not unconscious. So normally it is not when they are constituting. Here it says the goal of surrogate decision making is to reflect what the individual would have decided if able to speak for himself or herself. Okay. The goal is to speak for someone else. When do you speak for someone else? That's why I said literally, meaning the material may not be that authentic, but we can apply the strategies. I don't know where you got this particular stuff. So it says the goal is to speak for someone else. When do you speak for someone else? When he is not able to speak or she is not able to speak, right? So it is understood as when he is unconscious. A patient is unconscious. There are some exceptions, but we are not going to discuss on that. Only on the language aspect we will think. So when the patient has previously expressed preference, here this one, which I highlighted here, this particular portion is saying, this substitute judgment is used when the patient has previously expressed preferences or when the surrogate can reasonably infer what the patient would want. Means this substitute judgment is used when the patient has previously expressed preferences or even when they have not expressed preferences. In both the situations, whether they have expressed preference or they went unconscious without expressing any preference, in both the cases, the patient surrogate can make decision. So third one is not correct. When the patient has previously expressed preference, even if the patient has not expressed preference, as per the text, definitely patient surrogate can presume or infer what the patient want. Okay. So
in
third
the
one
second, in the second paragraph, they said, in regard to access of medical information and decision making, as would at the alert and competent patient. What does that mean?
That means a healthcare surrogate, this attender can make any access any medical information, ask for medical information, and make any decisions as if the patient is making. Did you get it?
Okay.
As if the patient is making. As if the patient is making.
Okay.
This patient's attender has got all the power to access all the medical information regarding patient and also make all the decisions as if patient himself or herself is making the decisions. Means if the patient surrogate comes to you when patient is unconscious and asking for the X-ray, MRI reports, details, the patient has the right to know, right? So also the attender has the right to know when the patient is unconscious. Is that clear?
Yes.
Any other doubts?
No, thank you.
Yes. Shall we go forward?
Yes,
Yes.
Father.
Yes.
Yes.
So only when the patient is unconscious is the right answer. Option B. Now let's take another one. Okay. What is identified as the most common cause of patient complaints? Hedging words or keywords?
Most
Most common
cause.
Most common cause. Okay. Option A, serious clinical errors.
Serious.
Clinical errors.
Clinical errors.
Okay. Option B, communication problems and unmet
Problems.
expectations.
Both, Father.
Problems
Communication
and
problems.
Yeah, both.
And
Okay, both.
Conjunction.
Only failures in medical treatment.
failures.
medical
Always staff negligence.
negligence.
Hmm?
Staff negligence.
Staff negligence.
Before that,
Always.
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 Eliminate.
Absolute.
Always only
Absolute
can be
right?
eliminated.
Only also.
Always.
Only.
Only.
This can be eliminated. And here it is
Only.
Only.
only. That is absolute. So you can eliminate this. And from common general knowledge of your profession, you know, only failures in medical treatment is not the only complaints by the patients, right? Even some bed making
Yes.
or other facilities, anything can be the issue, right?
Mhm.
Not only the treatment.
Yes.
Other aspects they can raise complaints about other aspects of hospital life. Always staff negligence. No, it's not always staff negligence. There are many other reasons. So you see, even the meaning itself tells you with your general knowledge as a medical professional, these are not right answers, right?
Yeah.
Now what happened?
Yes.
Now you have 50% reduced burden. You have only two options to decide. Let's see if you can say somebody can prove that C or D can be the answer. You can prove it. Okay, don't believe me.
Only one
Okay.
plural is there.
Yeah.
Option B.
And
B,
is
Father.
And
Okay.
Second
the
line
rest
is
is singular.
Yeah. Even otherwise, our general knowledge also, you know, not only they speak patients complain only about serious clinical errors. Even simple errors they complain sometimes, right?
Yes.
These are common. If you simply smile at the material and enjoy it and try to understand, instead of saying, "Oh, reading is difficult," the very fact you say, remove that, you take the dictionary and just tape out that the word difficult. Should never utter regarding OET. Okay.
Yeah.
Just think, simply think. Okay. Now let's see. Text managing patient complaints in healthcare. Somebody read. Let's see if somebody can prove C or D is right answer. Somebody said communication problems and unmet expectations. They said because there is a conjunction, and normally when there is a conjunction, that is most probably usually the right answer. So even without reading, once you're competent, you won't read at all, because even otherwise, you know, patients complain not only about serious clinical errors, they complain about even silly things, right? Some patients complain, right? Yeah. So most probably the right answer. So even without reading, once you're competent, you won't read at all, because even otherwise, you know, patients complain not only about your second instrument. They complain about even silly things, right? Some patients complain. Right. Somebody has not muted the instrument, please. Yeah. That means can you make out? Because even otherwise, you know, patients complain not only about your second instrument. Hello? They complain about even silly things. Can you hear me? Somebody has not muted the instrument. Hello? Am I audible?
Yes, Father.
Yeah, this is why sometimes we don't admit you in between. Somebody, see, there are such a long distance, you know, your audio is heard. What I spoke earlier was heard to me. So please mute if you have a second instrument. Always have a second instrument, but mute one instrument. Okay, cool. Okay, let's read. So I was saying here you can use this absolute, eliminating the absolutes. Then one I said whenever there is a conjunction, most probably it is for the option with the conjunction. Or also in the 7 skills of elimination I have taught you, normally the longest option with many words has got most probability to with the right answer. So you are applying 1, 2, 3, 4 strategies in this question. So definitely without reading the text, you can find the answer once you are competent, but now you need to read the text, okay? Please, someone, please.
Text. Managing patient complaints in healthcare. Patient complaints are an important source of feedback for healthcare organizations and can contribute to service improvement when handled appropriately. Most complaints arise from communication breakdown, unmet expectations, or delay in care rather than clinical incompetence. Effective complaints management requires timely acknowledgement, clear explanation, and where appropriate, an apology. Staff involved should be supported throughout the process to encourage openness and learning. While not all complaints can be resolved to the patient's full satisfaction, a transparent and respectful response can reduce dissatisfaction and prevent escalation. Importantly, organizations should analyze complaint trends to identify systemic issues rather than viewing complaints as isolated events or assigning individual blame prematurely.
Okay. Any clue to any answer?
Communication problem and unmet expectation.
Here there is one more clue. Beginners, don't worry. You may not know what is a scale, but then here there is a scale. If there is a scale, if you have a scale or synonym,
The second line.
straight away go there is the principle. Go to the scale. If you are beginner, don't worry, you will learn it, okay? If there is a scale expression in the question term, go to the scale expression, same scale expression or a synonym in the text. Most complaints arise from communication backgrounds and
Unmet expectations.
so which is the answer?
B.
Yeah. Even see, this is like asking the students, giving the textbook, notebook, everything, and you write the answer. Just copy the answer. Just read and tell us what is the answer. Such simple things, right? See, now what is this option? Serious clinical errors. Rather than, whether you can understand this expression they are looking. Rather than
clinical
incompetence means say they are saying this is not the thing, right? Yeah. In the same sentence, they are helping us to eliminate this option. Now again here, issues rather than viewing complaints as a event, or rather than, tell me which option I am highlighting now. Connected to which option? Opposite of? Staff negligence. Always staff negligence. It says rather than assigning individual blame to staff, identify the things and try to solve it. So it is opposite of fourth option. Is that cool?
Yes.
How beautiful, right? You are lucky to practice such things. Even this material is sent by some aspirants. Okay, I don't know where it is from. I don't know the copyright issue. Cool. Any doubts?
No problem.
So we have seen only can be, and there is only. It may not be absolute. Sometimes it can be absolute. First one, it only was not absolute. Here it is absolute. That tells you the absolute word, appearance of absolute word is not enough. The meaning should be absolute.
Absolute also.
Yeah, exactly. Let's see one more, then we'll go to the principles a bit. According to the text, which statement best reflects the use of telehealth in primary care? Hedging words?
Best reflects.
Best reflects.
Best reflects.
Okay, best reflects. Option A, telehealth is always appropriate for managing chronic conditions.
Always and managing
Always.
chronic conditions.
Always.
Managing chronic condition.
Always. Once you have always, is the
Always.
meaning always?
Absolute.
Yeah, meaning is also always, right? Telehealth is always appropriate for managing chronic conditions.
Mm-hmm.
So can I eliminate?
Yeah.
Yes.
Don't believe us. Okay, these some people are shouting, others don't believe them. Okay, don't believe me as well. Only from your experience, you have to gain competency. B, telehealth can be useful, but is not suitable for all situations.
Useful.
It's not suitable for all situations.
Not suitable
Now
for
all
all
is there, right?
situations. Yeah.
No, Father, it is not suitable
Not
for all.
not
Active
absolute.
expression.
Meaning is not absolute. Meaning
Not
is not
Meaning
absolute.
is not
Not
absolute.
suitable for all means suitable for few situations
It's
only,
not
right?
absolute.
Yeah, suitable for
Meaning is
some
not absolute.
situations. Again, one our dear friend is here.
Mm-hmm. Yeah.
Conjunction, but
Okay.
Mm.
See, all is there, but you cannot eliminate because the meaning is not all. Telehealth can be useful in some conditions. It can be suitable in some situations.
Mm.
The meaning of option B is telehealth can be useful in some situations or suitable for some situations.
Mm.
Yes,
Correct?
Father.
Yes.
Let's see. Then next, see option C, telehealth completely replaces the need for physical examinations.
Completely.
That is
Absolutely.
completely.
Completely, even from your general health, you know.
Yeah.
Only through a phone you cannot have all the treatment, right?
Mm.
Correct.
Yes, Father.
Actually, you need not study anything. You just think from your knowledge. Please mute if you have a background distraction. One with a child, please. Please, അമ്മയൊന്ന് മ്യൂട്ട് ചെയ്യുവോ? മോനെ ഒന്ന് മ്യൂട്ട് ചെയ്യുക, അല്ലെങ്കിൽ അതൊക്കെ ഇറക്കി വിടും. Please. That mummy with a child, please. I can understand you have a lot of difficulties and challenges, but shouldn't be disturbing everyone, right? Cool. Option C, telehealth completely replaces the need for physical examination. I was saying, you yourself know, you cannot have telehealth, means over the phone call or something like that, you cannot have all the examinations, right?
Yes.
From general knowledge, I am saying just enjoy, try to understand and enjoy these things. No? So that is also eliminated.
Eliminated.
Now, okay. Now next one, telehealth should only be used when patients request it.
Only.
Absolute.
Doctors and medical professionals should never make a call to the patient unless they request. You should not even make a call to call them for the examination or to collect the results. It's only absolute.
General statement, but it is wrong.
Absolute.
Yes, it is
Yeah.
absolute.
Not absolute. Meaning is not absolute.
No, it's absolute.
Absolute, Father.
Absolute. Let's check. Somebody has some objection. Let's check. From the request. Since somebody said, I just eliminated. Okay. That doesn't mean I support them. Let's fight.
Should also.
Yeah.
Should also model verbs, right, Father?
Which one?
Should. Telehealth should.
Okay.
Only.
Yeah.
Should is also model verb, right?
Yeah. And always take caution. Should model verb or the scale or the name, all these tips should appear in the question stem.
Only.
To be a strategy, to be a clue, it should appear in the question stem. Which is the question stem? This one. Okay?
Yes, sir.
First
Yes,
portion.
Father. Yes, Father.
Appearing in the options or in the text is not the primary thing. Maybe options there, something may appear that may be wrong option. Okay? When it reflects here, and as we have seen in the previous, and most was there in the question hand. So immediately we went to the text where most appeared. Let's read and understand. Okay, I have not agreed. Okay, eliminated means temporarily somebody objected for the fourth one, saying it is not absolute. So I'll have to remove the strike. Okay, let's see. Please read.
Telehealth consultations in primary care. Telehealth consultations have become an important component of primary care, particularly for patients with stable chronic conditions. They allow clinicians to monitor symptoms, review test results, and provide follow-up advice without requiring in-person visits. However, telehealth is not suitable for all clinical situations. Patients presenting with new, complex, or worsening symptoms may require physical examination to ensure accurate diagnosis. Additionally, technological barriers such as limited internet access or lack of digital literacy can affect the quality of virtual consultation. Therefore, clinicians must use professional judgment to determine when telehealth is appropriate and when face-to-face assessment is necessary to maintain patient safety and quality of care. Thank you.
Okay, any clue?
Yes, Father.
Father,
Contrast
therefore, it's a contrast word. Yeah.
After the contrast word, you have the answer, right?
Yes,
Yes.
Father.
Yeah.
Directly answer is there.
That be options.
Mm.
Maybe.
Okay, then actually once you are competent, you need not read rest of the portion at all. So telehealth is not suitable for all clinical situations. Telehealth can be useful, but is not suitable for all situations. They said telehealth is useful, become an important component of primary care means it is useful, right?
Yeah.
Okay.
Father,
Important.
therefore, it's a contrast. The last sentence.
Yeah. Therefore, clinicians must use professional judgment to determine clinical judgment. Therefore, is not a contrast word. Okay.
Therefore, not a contrast word.
It's a
No, no, no.
conjunction,
Therefore is a conjunction.
Adverb
Yeah. That's not a contrast word. Therefore means because of all these, we are concluding, right?
Okay, Father.
But then this has a clue to one elimination. What is that?
Yes, Father. D.
Option
Answer
D.
The telehealth should only be used when patients request it. This one says clinicians must use professional judgment to determine when telehealth is appropriate, not when the patient
D option we can
requests.
eliminate.
Yeah. So
Yes.
4 absolute words are there. 3 options are absolute in meaning, but B option is not absolute in meaning. Not suitable for all situations means suitable for some situations.
Some situation.
How beautiful. So once you are competent, you can simply eliminate these A because there is a absolute, and B there is a C there is absolute, and D there is an absolute, and B there is an absolute, but that is not absolute in meaning. Usually they trick you with this. If they have this trick, that shows that is the right answer. Not only that, my friend, but is there. Whenever there is a conjunction, most probably, I don't say 100%, most probably 99% that is the right answer. And do you need to read the passage? You need not read at all once you are competent, but now you have to read everything what is given. Okay. So what is the correct answer?
B.
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 Anyone has any more objections?
No, Father.
And how do you say this is, if you say this reading is difficult, you should be taken into the jail and punished, right? I have not selected anything. All these are from sources or your discussions. Some students have sent me asking it is serious, difficult. Okay. Is that clean?
Yeah, clear.
Yes, Father.
Yes. So beauty of absolutes. So maybe one more time with this context, we will check what is elimination with absolutes, okay? So that you make it very clear in your brain. Elimination, absolutes means the extremes. I already taught this, but if there are some beginners, and also you fix in your brain, extremes means North Pole and South Pole. All and few. Few means there are few students in the classroom means
No student.
No students.
there are no students. There is little water in the well means
No.
there is no water.
A little.
A few means some, a little means some, not few. Few is negative. So that's why it is the extreme, south extreme. Okay. So you have always, often, most of the time, sometimes, seldom, rarely, never. So which are the north and south extremes? Always,
never.
Always
and never. Okay. Make this very clear in your brain. So many questions are there. Even from the official material, I'll show you. Even on the website, every this one has. Maybe I have taught you all these 7 skills. There is a video in the YouTube channel. You can watch elimination method. If you type in the EduSkills OET YouTube channel, just type elimination method. And that will give you all these 7 elimination methods. Okay. Out of which we are
What does
looking at.
radical mean?
Pardon?
What does radical option mean?
Radical option means this, man. Extremes, always, never.
Okay.
She is always irritating me. Is radical. She is not always irritating you. She has got many other business. She is sleeping sometimes. She is eating sometimes. She is smiling sometimes. Usually we make a statement, no? She is always irritating me. Is that true?
No, it's not true.
That is called radical statements. The patient is always irritating me. Immediately, if some of your colleagues say the patient is always irritating me, you have to say wrong scale. Scale is
Yeah.
wrong. Don't be radical.
Yes,
Okay. So eliminate the absolute or the radical options. My system is a bit slow. That means avoid north-south options, extreme values. Why? Because in the medical field, nothing is absolute. You can't say this particular medicine can be given to all the patients with this complaint, right? Some cannot be given. Some will have allergy. Okay, so you can use words like this, never. Okay, all, every, sorry, always. These are the radical expressions. No one is really serious about the duty. None is serious about the duty. Radical, right? Can somebody make that statement? No. So these are. Now the thing is this. I have once explained, but I am giving you one more time in this context because we have a lot of doubts regarding this. Absolute versus qualifying language. This is a difficult specialty of medical profession. Why language matters in OET Part C. OET test, what does it test? Professional judgment, not memorization. That's why we say don't practice too many materials. Understand, they are looking for professional judgment. Second, OET tests, your answers should always reflect clinical realism. That's what I was saying. From your general knowledge, professional knowledge, you know certain things are not right. So clinical realism is reflected in your answer. Extreme and rigid statements, that's what somebody asked me, radical statements are rare in healthcare texts. Okay. Understanding language tone helps you eliminate distractors quickly. You have to understand the tone of the language. That is what I am trying to explain in the options. And these words we have seen. These are the words. But sometimes I'll give you one more exception. Sometimes we need not have this particular word, but if the meaning is absolute, that can be eliminated without these words. I'll show you exception. Sometimes you can eliminate an option without having any of these words, extreme radical words, but then the meaning will be radical. What is qualifying language? So far we said is radical language. Qualifying language allows flexibility, allows judgment, professional judgment, allows exceptions. Okay. Qualifying words in OET reading, part C. Usually. Is it absolute?
No,
No.
it is not absolute.
Often, not absolute. May, not absolute, not radical. Can, not absolute. Most, not absolute. That is, all is absolute, but most is not absolute. Generally, it gives flexibility. Generally, there will be some exceptions, right? Depends on certain conditions. In some cases, these are known as qualifying words. Now let me know, correct or incorrect. Consent is always required in every situation. Medically, is it correct or not?
It's
No,
not.
Father.
Not correct.
Why?
Some critical situation, except
Yeah. Now, who is the villain here in this sentence?
Radical.
All.
Always.
Always is the villain that makes it incorrect. Now, telehealth completely replaces face-to-face consultations.
Completely.
Yeah, completely.
Completely is the villain, so it is incorrect. Older adults never adhere to medication plans.
Never.
Never is the villain, yes. Complaints are only caused by medical errors.
Only.
Only, yeah. So all these are incorrect medical statements. Okay?
Yeah.
Usually incorrect when you have always, completely, never, only, all those words. Now let's see some usually incorrect and how can you make it correct sentence. See, consent is always required in every situation. Consent should be sought when appropriate. Okay? This is qualifying language. Which is right?
Yeah.
Right. No consent should
Consent should be
Consent should be sought when appropriate.
when
Okay.
appropriate.
Telehealth completely replaces face-to-face consultation is wrong. Telehealth can be useful, but not in all situations is right.
Mm.
Older adults never adhere to medication plans is wrong, we have seen. Medication adherence varies between individuals is right. Complaints are only caused by medical errors is wrong. Complaints often arise from communication issues is right. Often, not always, not never. Okay?
Okay.
So, you have this concept in your brain so that you will not confuse the absolute language and the qualifying language. These yellow ones, all are villains. My system is teaching me patience. All patience, most patience is right. Okay, elimination absolutes. It's already seen. Okay. Sorry, my system is not responding. Slowly, it's teaching us patience. Patience is key to
Success.
OET success. So let's learn some patience. Sometimes when I click, it is going very fast. Sometimes it's not moving at all. Okay. So absolutes and quite opposites. two of the most often used 7 eliminations. Even 7, all the 7 can be used, 7 principles, but these are most often used. Once more, if there are some beginners, to make it clear to you, all means %. Most means something 90 plus, 80 plus, anything, depending on this one. Majority means 50 plus. Minority means below 50. A few, some means 1 plus anything. Few means 0. So 0 and 100 are the extremes. Now, exception to the principles of absolute. Meaning of the sentence or the answer option is not absolute. It's an exception. Meaning of the sentence is absolute word is used, but the meaning is not absolute.
Absolute.
Meaning also must be absolute. Absolute words are not used, but the meaning of the sentence is absolute. See the difference?
Yeah.
First one, they are using the absolute word, but then the meaning is not absolute. Already we have seen example. Second exception is absolute words are not used at all, but the meaning of the sentence is absolute. I'll show you some examples. These words are not used, but the meaning is absolute. Did you get the meaning?
Yes, Father.
Third one, opinions. Opinion doesn't mean opinion questions. You cannot ask, work out this absolute principle at all. Sometimes you can, but there is a precaution. Be careful. Sometimes somebody can give an opinion which includes absolute words. It's an opinion. It's not the factual statement. So it can be right. Exception, the meaning of the sentence option is not absolute. Exception to, Exception 3. Let's see. Okay, let me just put in a mode where I can highlight. Okay. This is a big passage, right? Let's see. 16, Philippe Hijol's comments in the first paragraph indicate that he believes. Are the hedging words?
Believes.
He believes. Okay. Now, option A, no one knows how to prevent plague.
No one.
What is it?
Absolute.
Not absolute.
Somebody says not absolute. Objection,
The
Your Honor.
opinion, absolute, but on the opinion words we cannot eliminate.
Yeah.
No one is not an absolute.
That doesn't mean an opinion you cannot eliminate. Okay, sometimes it can be the answer. Let's see. So you want to say it need not be eliminated. I am not eliminating it. B, option B, everyone has plaque on their teeth.
Everyone.
Absolute.
But people said we cannot eliminate. Only fluoride can remove plaque.
Only.
Best example, right? Yes. Plaque is impossible to remove.
Impossible.
Somebody was asking me all 4 absolutes. So no right answer.
Let's go to the Philip.
Okay. Okay. Come on now. Read. There are 4 absolutes. Who is our sweet absolute? Let's see. This is one exception. Yes, just read.
If your toothpaste is fluoride-free, brushing and flossing alone aren't enough to keep cavities away. According to the recent study, the fluoride is what helps you avoid cavities, say lead researchers Philippe Hijol, PhD, settled periodontist and professor of oral health science at the University of Washington. It's not simply keeping the teeth cleaner. For years, dental professionals have debated the importance of the clean tooth hypothesis versus the sound tooth hypothesis. Is the preventing cavity. Those in the first camp say good oral hygiene will remove sticky films of acid for producing plaque that breaks down the enamel and allows cavity-causing bacteria to invade the teeth. Others argue that brushing and flossing, no matter how intense, isn't enough to prevent cavities. The plaque is inaccessible and you can't get to it, Hussein said. While oral hygiene may help a bit, it's the fluoride that makes the difference in getting to the plaque and breaking it down. He says, cavities begin in tiny cracks and crevices in the enamel. Exactly fluoride helps prevent cavities is not certain, according to Hussein. There is some evidence it may inhibit the enzyme that breaks down the tooth, he says. In general, experts believe fluoride helps restore minerals to the enamel, helps strengthen the tooth, and even helps reverse the early cavity process. Thank you.
Yes. Now another principle, if there is a name, you did not ask me to highlight the name here, right? Did you?
We say,
Yes,
yeah.
Father. It was
Yes,
very first
Father.
paragraph.
We did.
And that's the first paragraph too.
First paragraph.
In the
The
first
questions.
paragraph also they have
Okay,
mark.
beginners need the first paragraph. This tells you have to number the paragraphs. Okay.
9th paragraph, Father.
Okay, now if there is a name, what is the principle?
You can go to the
Immediately
direct.
Direct for the name.
So for the name and the, if there are 2 times or 3 times, normally the later
Second.
Or
one.
the last one.
Second
Last.
one, last one.
Second name.
Do you have
Third
something
name.
here? The plague, this is what he says.
He
The plague is
inaccessible.
He says also.
Any connection with any of the options?
Option D is impossible. Like is
Yeah, the
impossible
plague
to
is
remove.
inaccessible and you can't get to it. If you can't get to it, if you cannot access it, can you remove it?
No, Father.
No, Father.
So this is the
Answer.
answer. And once you are competent, you need not read all these things. See the name and go to the names. Here, these are those in the first camp, those others, second camp, third camp. We are not bothered about others and those camp in the first camp and second camp. What they did, they say. You shouldn't be wasting your time reading and understanding those things. What Philip Hujel says is important. He has said 2 things. Normally, the second one will be the thing on. Even otherwise, you have to just look into those 2 statements and find out which is correct answer. So, this is absolute. This is absolute. Sorry. Okay. And this is absolute. The 4th one is absolute, but he believes, says that is his belief or opinion, right?
Yeah.
He believes. So, since it is an opinion that impossible, because he is saying some other doctor might have already got access to it and removed the plague, right? But this guy believes he cannot. Okay. Maybe one of you will say, maybe that patient can never be satisfied. Okay. He keeps on complaining, he can never be satisfied. Another colleague of yours may say, he's a wonderful patient. He's so happy. The patient may be happy with her. Right. So impossible can be possible. Yes. Did you get the difference?
Yes.
Yes,
Yeah.
Father.
But then I tell you, these are very, very rare questions. Okay, they're happening. This exception, very, very rare, maybe 1%. If you are not in that much particular that you should get 500 out of 500, you need not break your head on these exceptions. If 450 is enough for you, A plus is enough for you, then you not break your head. But it's good to know these things, exceptions. Exceptions are only for those who need to get more than 450. Okay.
Okay, Father.
Yeah. But you can get, don't worry. Definitely you can get even 500 out of 500. I want to see some people get it. Why not? This is, as I told you, if there are beginners, I am not speaking about these exceptions. I already told you, but once again, I want to tell you, copyright issues. I want to give the credit to this man, okay, William Poundstone. He's the one who found out these techniques, okay, about elimination methods. Rock, Break, Scissors is the book written by him, a practical guide to outguessing and outwitting almost everybody. Means he has studied 24,000 MCQs and he brought in all these 7 skills. Okay, and the link is given, that elimination method, this link is given there. It's a free book if somebody wants to read more. Enjoy it. The link is given in the description of that elimination method video. It's not necessary for OET, but if you want to be OET teacher, you can do it. Do you have some more stamina or should we stop? What do you say?
We can, Father.
Continue, Father.
Continue,
Continue.
Father.
Yeah, 2 minutes. 2 minutes will give you a break because 1 hour, right? If you want to grab some juice or something, snacks. By the meantime, others can interact, those who have snacks at your hand. Okay. Anything you want to interact? And I want someone to tell me, why do you say this is difficult?
Because when Father is there, everything is really easy for us.
No, material is same, right? It's not my material. Now, the rest of the examples I'll give you from most of them from official OET website. Same strategies. Even when I am not there, you can do it. They are doing it during the discussions, evening 8:30 discussions. People are doing it. One thing is this: OET is maybe challenging when you are studying it alone. That's why we have group discussions arranged. When it's in group, it becomes interesting. Sitting alone may not be that interesting.
Yeah.
That's why we have provided you free platform, Zoom, anytime. Admins are opening for you. You can discuss, you can study together instead of simply sitting and sleeping. Okay. Amita is here, or did Amita go out? No. Amita, if you are listening to me, you can come and join, okay? If you are the one who was distracting, I can understand your duty schedules, and maybe you are not. Okay. Yes. We understand certain things because people have 12 hours duty, then travel, then looking after the kids, all these difficulties, challenges we understand. But sometimes we have to keep the decision. Have some snacks, 2 minutes gap for you so that you enjoy. Okay. Anjani, don't have anything?
Yeah, Father.
Why not? Whenever there is class, you have to buy something and keep. Yes. I have to drink some water or something like no. Mine should be fresh and energetic.
Happy Republic Day, Father.
Thank you. Wish you the same. Yes. Any concerns at the YouTube? You can type in 2 minutes. We are waiting for the people to have their snacks or juice. Enjoy the sessions. Hello, sir. Yes. Diksha Baga. I am here, Father. Sadija. Okay. Yes. You mean Amita is saying I'm here? No. Right. It's an opinion-based exception. Okay. There is 2 straight opposite in the answer options. play quiz in the and you can't get to it. Okay. Yes. Come on now. If you are there at YouTube, you can comment, and if you have any concerns, you can let me know. I will try to address them. This is Amita from YouTube. Okay, Amita, cool. If you want to come on Zoom, you can come, okay? Give me 1 sec. Keep interacting. I'll be back in 1 sec, okay? 1 minute. Yes. Are you ready?
Yes, we are ready.
Yes. When you're exhausted, you let me know, okay? When you're tired, you shouldn't be going on.
Still, there is stamina to go.
Okay. Yeah. By the meantime, try to share the link to others so that we reach out to maximum number of people. Okay. When we are spending our time preparing these PPTs and spending time, let it reach maximum people. You should have love for your colleagues, health professionals, right? Yes. And also, if you have not clicked the like button, the more you message in the comment space and click the like button, it will reach more people. Yes, Alfonso de Silva. Alfonso de Silva says yes. So simply click some emojis, some love, some heart in the comment space. Let it flood. Okay. Chat rate is 0 as of now. Chat rate should go above 10, then it will reach more people. Now it's 0. Yeah, hearts are coming in. Worli Prabhakar, Dorothy, Varsha, yes, let the hearts, emojis, EduSkills, OET, all come in. Even typing in more EduSkills, OET, that also helps people to reach this particular platform. See, we have such unlimited resources, free sessions, everything available here. Still, people are struggling even financially and spending lakhs of rupees to study these things. That shows our selfishness. We are not reaching. Yes, Alfonso de Silva. Yes, Dorothy. Yes. Thank you for those super chats. All those people, Wally, Alfonso, Dorothy, and yeah. Yes. Yeah. I love EduSkills, Subi Selva. Yes. And will you be saying reading is difficult?
No further. Only practice makes
You can
perfect.
send any material, but then don't send material without answer key. That will never be authentic. That's why we ask you to post all your questions with answer key. Otherwise, you'll be confusing people with unauthentic materials. There will not be any strategy. It will be a waste of time discussing on those things. So anything that you have answer key and you find this answer is not right or I am getting another answer, you can send me the material. I will explain, okay? I'm in search of some challenging passages. Okay? So whichever is challenging, you can send me. Yes, chat rate is improving. Yes. Thank you. Yeah, see, and the chat rate improved. 5 new people joined. I can see here. If you can see the viewers, you can see current viewers. 5 people joined, around 30 people because of your chat visited and left. Still, it's good. So those are the things which you can simply do without any cost. Okay. Any concerns you can type in. We'll try to accommodate those concerns in this session. At YouTube, do you have any concerns, Ranjini? Yes. Right, yeah. EduSkills is a free platform. Yes. All those who have purchased super chats, thank you so much. for helping the platform. Empower each other and grow together. Yes. Blessedness, 100%. Yes. Right. Shall we begin?
Yes, Father.
Yes. Okay, let me share my screen. So far we have seen one type. Now you know the straight opposites. One of them is correct, you said. We'll see one from the official material, I believe. I'm not very sure. Thank you, OET, for allowing me to use this for teaching purpose. Okay. Okay. The question is it visible to you at YouTube, my screen?
Yes, Father.
Yeah.
Yes.
Question 12, the Cancer Council advises that, option A, there are many health benefits of alcohol. Hedging words here in the top, in the
Cancer
questions,
Name.
Cancer Council. Okay. And there are many health benefits of alcohol.
Benefits.
Any benefits?
Okay. Benefits or health benefits. Okay. Then option B, the benefits of drinking red wine to prevent or treat heart disease is conclusive.
Is
Conclusive.
red wine
Is
conclusive?
Drinking red wine and conclusive.
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 Red wine is conclusive.
Conclusive.
Okay. Option C, the evidence that alcohol can prevent or treat heart disease is inconclusive.
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 And
Inconclusive.
alcohol.
Prevent or
Is
treat.
that straight?
Okay. Option C, D, there is a safe level of drinking 1 or 2 standard drinks a day when it comes to cancer.
Standard.
Safe level of drinking. One more.
Standard.
Safe level.
Okay. Any clue here?
B
Straight
and C
opposite.
are
B and C.
quite
There is two
opposite,
direct
Father.
opposites.
B and C are direct
Conclusive.
opposites. The principle is
A and D is
Other
eliminated.
two are eliminated.
other 2 are eliminated.
Um,
Then you are left with only 2. Just read the 10 sentence text.
First line, second
Sorry.
line.
Please
Cancer.
read.
Yes.
But what about the heart health benefits of alcohol? Well, the evidence is inconclusive and potentially flawed at present, the Cancer Council says, adding that the National Heart Foundation advice against drinking red wine or any type of alcohol to prevent or treat heart disease. The message to consumers is that there is no evidence to suggest there is a safe level of drinking when it comes to cancer. However, given that the risk increases with amount, the Cancer Council suggests that anyone who wants to drink should stick to the National Health and Medical Research Council guidelines. No more than 2 standard drinking a day for health men and women. A standard drinking is usually described as the equivalent of 100 ml of wine or 285 ml of beer, but it can vary depending on the alcohol content of the beverage.
Okay. Which is the answer?
Second line, Cancer Council says.
Father.
First
C is
line,
the answer.
The evidence is
conclusive.
inconclusive.
Inconclusive.
So it is there in the very beginning. first
Yeah.
part of the
Yes.
text
In
itself.
the topic
And
sentence.
and this one will be the rest of the things you need not read at all, because those two things are there, inconclusive or conclusive, and this is inconclusive, right? Then you need not read. That is a topic sentence. And here there is another answer. In the next question, there will be another answer. So, inconclusive, conclusive. Opposites. One is correct answer. Clear?
Yes, Father.
Yeah, we will not go into the details. Okay. We'll take some more examples. Then we'll come to the concerns I have taken up. We'll come to that. Let's see from one from big part B. Okay. What does the policy for manual handling equipment tell employers? Hedging words?
Tell employers.
Manual.
Policy.
Policy.
Policy
Policy.
for manual handling.
Okay. Then option A, all areas of the hospital should be fitted with overhead tracking.
All.
All. Absolute.
All is an
What is it?
Absolute.
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 Yes,
So can I eliminate?
Yes, Father.
Yes, Father.
Then
Yes.
assistant devices should be used over physically handling the equipment, handling the patient.
patient.
Assistant devices.
Assistant.
Assisted device.
Okay. Then C, patients have the final decision on how they should be assisted.
Patient.
Patients.
So one is assistant devices, other one is patients, right?
Yes, Father.
Just read.
Policy for manual handling equipment. The provision of ceiling hose technology and air-assisted patient lifting equipment should be considered as the first-line handling aid by employers, as significant evidence exists that their use reduces operator and patient injuries. Overhead tracking should be installed in all new or refurbished facilities. This should cover beds as minimum, but should extend and ensuite and other areas of the facility where patients are likely to require assistance. Once an assessment has been made, the equipment should be used for safe patient handling. Then equipment should be made available and used even in a situation where the patient and her family's preference is for it not to be used.
So which is the right answer?
B.
B.
Eliminate this.
How do you eliminate C?
Even in situation.
Okay.
In the last line, it is.
Yeah, last line says C can be eliminated.
Yeah.
This C is the opposite of it, right?
Yes,
Patients have the final decision. It says even in
Not
last line
to be.
says even in the situation where the patient's preference is for it not to be used,
Not
should
to
be
be
used.
used.
Yeah, so that is opposite. C, so assistant events should be used over physically handling the patient. That is it. Should be considered as the
Second.
first line handling. Even this gives the answer. Any other option? Any other considerations given?
In the fourth line, we can eliminate the answer A option further.
Fourth line. Yeah, all new or refurbished areas. All new or refurbished facilities is not all areas, right?
Yes,
There are
Father.
some areas. Yeah. So B is the answer. Clear?
Yes, Father.
Yes. So B is the answer. Next one. Yeah. The purpose of the notice is to explain to occupational therapists that hedging words.
Purpose.
Okay.
Notice.
Notice.
Occupational therapist.
Occupational therapist.
Option A, confirmation of equipment is subject to availability at the time of request.
Confirmation.
Availability at the time of request.
Availability. Then second one, mattresses are of standard size, so may not be suitable for all bed types.
May not for all bed.
Will not be.
Suitable
May
for
not
All bed
be
types.
suitable.
standard.
All is it
All it
Not
is not
No,
absolute.
Not
absolute?
Not an absolute.
Not
Yeah,
absolute.
it's
It
not
means
an absolute.
some of
May not
beds.
be suitable for all bed types means suitable for some bed types, right?
Some bed
Yeah.
types.
Meaning is not absolute. So it's not absolute. You cannot eliminate it. And I said if there is such a trick played, that must be the right answer. Correct? You remember, if that
Yes,
ulta
Father.
trick is played, that is
Yes.
going to be the right answer.
Mm.
So once you read, you will know, okay, they are playing a trick here. Then immediately you can trick them. So nice. Option C, patient factors must be considered prior to lodging a request form.
Patient factors.
Yeah. Once you become competency, you don't read anything. Knowing this technique, you will choose this answer. Okay. Not now, once you're competent. Then time management, you will have a lot of time left out. Let's see, let's read. Come on. Read the
Equipment
passage.
request form for pressure care mattress. It is the responsibility of the occupational therapist attending to the individual patient to submit an equipment request form. Based on equipment eligibility criteria, a pressure mattress may be appropriate when someone is at risk of a pressure injury as evidenced by documented sound clinical reasoning and their pressure injury risk is unlikely to significantly change. Environmental and equipment consideration must be confirmed, such as that a patient's weight is within the safe workload of the equipment requested. The size of the mattress must also be compatible with other bed equipment and accessories, and the patient has been informed regarding the contraindications of placing items, example, continence products, sheep nikes, electric blankets, ill-fitting bed sheets on top of the mattress only after the confirmation should on ERF be submitted.
So confirmation of equipment is subject to availability at the time of request. Do they speak anything about availability?
No, Father.
No, nothing is mentioned about availability, right? Do you have anywhere?
At the time of request, no, it's not mentioned, Father.
Size. Mattress size.
Okay, mattresses are of standard size, so may not be suitable for all bed types. Patient factors must be considered prior to lodging a request form.
No, Father. It is based on equipment
on the
eligibility
topics.
criteria.
Yeah, topic sentence controlling idea says equipment eligibility criteria based on ERF should be based on the equipment eligibility criteria, not the patient criteria. They are of a size. They can't change sizes. You have to see whether it fits your patient. So, occupational therapist should fix it, and equipments are of standard size, and you have to confirm whether your requirement is as per the standard size. Otherwise, don't request. Is that clear? Patient factors must be considered. Do you have anywhere this says patient factors must be considered? Environmental and equipment considerations must be confirmed.
Needs to be confirmed, such as patient weight.
Such as that of patient's weight is within the safe workload of the equipment requested.
Yes.
What is the message? The mattress can bear 50 kgs of weight and your patient is 150 kgs. Can you request a mattress? Can you give the equipment request form?
No, can't.
No.
Mm.
Because in the topic sentence itself, they are saying ERF should be based on equipment eligibility criteria, not patient criteria.
Hmm.
Do you understand? Topic sentence, if you remember, topic sentence controlling idea is very, very important. We have gone through the this paragraph structure episodes I have published and the sessions taken. Clear?
Yes.
Any doubt? If you want clarification, let me know. Hmm? Yes. Shall we go on?
Yes.
So the answer is B.
B.
All these are from same material, okay? 3, 4, 5. How many questions with these absolutes? Number 5, the memo about the use of smartphones during surgery tells staff that
The memo.
Use of smartphone.
Use of a smartphone
Yes, smartphone.
so smartphones
tells the staff.
tell staff, okay. Option A, their use may be violation of patient confidentiality.
Violation.
Violation of patient confidentiality.
And confidential.
Okay. Option B, they are to be used only by the surgeon.
Only by
Absolutely.
the
Only
surgeon.
absolute elimination.
Only by the
Eliminate
surgeon.
further.
Only.
See, they can potentially lead to patient harm.
Potentially
Lead to
patient.
patient harm.
Patient harm.
Okay. Read, please read.
Memo restricted use of smartphones during surgery. As smartphone technology has become increasingly common, it is now a cause for concern when used within operating room, especially as a major source of distraction. For this reason, the use of smartphones within the operating room will now be restricted. The undisciplined use of smartphones, whether phone, email, or data communication, and whether by the surgeon or other members of the surgical team, may compromise patient care. Whenever possible, member of the operating team should only engage in urgent outside communication during surgery. Personal and routine calls should be minimized and kept as brief as possible. Incoming calls should be forwarded to voicemail or to the reception desk to be communicated from. Any use of device or accessories must not compromise the integrity of the sterile cage, and special care should be taken to avoid sensitive communications within the hearing of awake or sedated patient. Thank you, Father.
Yes. So what is the answer?
Their use may
C,
use violation patient for.
C.
Option C, Father.
Yeah, because potentially means may.
Yeah.
Maybe, potentially. Right? May compromise patient care means potentially lead to patient care, patient harm. Compromise patient care means patient harm. Right? Paraphrasing. Then their use may be violation of patient. That's already eliminated. Their use may be violation of patient confidentiality. Does it speak anything about confidentiality?
No, Father.
In the YouTube comment space, they have mentioned that as the answer. Does it mention anywhere? Patient confidentiality is the concept mentioned anywhere?
No, Father.
No, Father.
Personal and 24 should be. Income should be. To compromise the integrity of the sterile field and discussion. Care should be taken about density communications within the hearing of awake or sedated patients. I'm not speaking about this. Is not speaking about patient care confidentiality. Okay. Taken to avoid sensitive communications within the hearing of awake or sedated patients. Nothing to do with patient care confidentiality. This is the last sentence is saying, I think somebody has mistook it, and in the YouTube comment space they are saying confidential. First one is the answer. See, the care should be taken to avoid sensitive communications within the hearing of awake or the sedated patients. This is not nothing to do with patient confidentiality. They are saying patients should not hear it. Patient confidentiality means patient's communication should not be heard to others or given to others, communicated to others, right? Is that clear at YouTube?
Yes, sir. Yes, sir.
Especially a major source of distraction. Subi Selva, I didn't understand, leads to patient harm. Especially a major source of distraction means, where is it? Especially a major source of distraction.
But is not mentioned confidentiality.
Especially a major, so when used within the operating room, especially a major source of distraction means they can potentially lead to patient harm. It can be, yeah. There's a controlling idea in the topic sentence. Usually topic sentence will have the idea of the right answer. Is that clear?
Yes.
So answer is C. So see, don't confuse this last sentence. Special care should be taken. This is saying not about patient confidentiality. This is saying don't speak to patient. Don't tell them. Don't communicate to them. Patient confidentiality means speaking the things concerning patient to someone else. Okay, that is a confidentiality violation. Okay.
Yes.
This
Yeah, this one, another one, only by the surgeon.
No,
What is it saying?
and
Text
other
is saying
members.
whether by the surgeon or other members of the surgical team. So that is not right. That's eliminated. Cool. So the correct answer is they can potentially lead to patient harm. Again, 6, you see, it's on the same material. The sixth one also gives the same type of question. 6, the main point of the extract on subcutaneous cannulas is to explain.
Main point. Subcutaneous cannulas.
Cannula.
Yeah, if you are exhausted, you have to tell me, okay, you should not be doing it when you are exhausted. You will get frustrated. Extract on?
Subcutaneous
Main point
cannula.
and subcutaneous cannula.
Okay. Option A, the
Versatility of their
there is some spelling mistake.
Design and function.
Should be versatility, I believe. I don't know.
versatility.
Should be versatility of their design and function.
Design and function.
Versatility.
Design and function.
Must
Then
only
they must only be used by registered nurse.
Only.
Absolutely.
Eliminate further. We can
Only
eliminate.
Second.
Is it absolute?
Yes, Father.
Second.
Yeah.
Yes.
Only means
Eliminate.
only also means no one else can use it, right? No one else also is absolute. So that can be
Eliminated.
eliminated. C, the need for a backup cannula in case of malfunction.
Malfunction.
Case of malfunction.
Backup cannula in case of malfunction.
Okay. They are asking for the main point, okay, not the sub points. What is the main point? Where will be the main point?
In the topic sentence.
It can be in the topic sentence or
In
Yeah,
the,
decision will be in
the,
the
the
topic sentence, first
conclusion.
sentence or the second sentence. Okay. Let's see what is the topic sentence. Read.
A
Subcutaneous
subcutaneous
cannula.
is a small plastic tube designed to carry a medication into a person's body. One end
So, is
insert.
there is some clue? Is the topic
Yes.
sentence.
Yes,
No,
Father.
there is.
Medication.
Yeah.
Yes,
Design.
Father. Designed,
Personality of the design and
Okay.
function.
designed to
Now we
carry
have to see
medication.
for function. Yeah. One end.
One end inserted by a registered nurse sits just under the person's skin. The other end divides into two parts and is shaped like a Y. One part of the Y arm can be connected to a syringe driver or infusion pump. The other can be used for subcutaneous injections. The nurse may insert a second cannula in a different part of the body. This in a case the original cannula stops working and ensure that there will be no delay in giving medications to the person you're caring for. It can be especially useful if the original cannula stops working at night when nurses may not readily available or have the same level of support as during the day.
Okay. So what is the main point? Design and
Design and
The versatility.
function. The whole part speaks, first part speaks about topic sentence speaks
Versatility
about
of
design.
design.
So that must be design and
Function.
second point is subsidiary point is
It is, there is,
yeah.
it's
Second
not mentioned
point.
only be registered nurse.
No,
Yeah.
not only.
It is
That
not
is not
mentioned.
there. Yeah, already only is absolute, so we have eliminated and it's not mentioned,
The
right?
need for a backup
Yes.
Backup.
Need for backup is the secondary point, not the primary thing. Primary thing they are discussing about specifically
Design.
about one end, the
Design.
second end, how
Design
it
and function.
performs, what can be used for subcutaneous injections. So design and function.
Function.
The need for backup formula is not the main point. It is mentioned, but it is not the main point. Okay.
Yeah.
They are asking what is the main point. Main point always connected to the topic sentence.
Okay.
Gist also, gist based questions always, what is the gist or idea is always connected with the topic sentence. Main point connected with the topic sentence. The most important point will be given in the topic sentence, then explanation, secondary information in the next sentence, then the tertiary informations in the other sentences. If you know the paragraph structure, you know without any difficulty, that is the structure. See, if you want to know most important information, supporting details, general information. So which is the most main point, most important information. Correct?
Okay.
Yes, Father.
So, see, most important information in the topic sentence. Important information in supporting sentence. Less important information in developing sentence. Optional information in the conclusion. Step forward later. Feel, point, main point. Then explanation, then evidence, then link.
Evidence,
So point is here. Okay. So the main point. Designed to carry medication into a person's body means design plus carry medication into a person's body is the function, right?
Function. Yes, Father.
So the topic sentence, controlling idea in the topic sentence gives a clear idea about design and function. What is its function? Clear?
Yes.
Conjunction is.
Pardon?
Clear.
Again, conjunction is there if you want, yeah. If you want to take your friend, you can take that as well. No issues. Only that has a conjunction, right?
Yes, Father.
Yes,
This is the third option, third example today. You can definitely. Stamina, you have stamina?
Yes, Father.
Yes, we have.
Okay, then go on. The guidelines inform us that hemolysis, am I right? Testing
Yes,
and
hemolysis.
thrombogenicity testing.
Guidelines.
The guidelines.
Okay.
Hemolysis.
Hemolyzing and thrombogenicity.
Hemolysis and
Thrombogenicity.
thrombogenicity testing. Okay. Option A are generally not needed for the indirect blood contacting devices.
Not needed.
Not
Indirect,
indirect blood contacting device.
not need indirect blood.
Not needed. Okay. Okay. B. Option B can be waived through comparison to a similar legally marketed device.
Similar legally marketed.
Can be comparison
Similar.
Similar legally marketed device.
Okay. So option C are always redundant for the direct blood contacting devices. Yeah, highlighted indirect blood
Always
contacting.
redundant.
We have direct and indirect.
Always.
is
What is it?
absolute.
Are always absolute.
Always absolute.
So
Yes,
eliminate
the
this, right?
Element.
So we choose A.
Hmm?
A and
Which is the answer? Read, let's see.
A.
Read.
Hemocompatibility for devices having direct contact with circulating blood, it is recommended that you consider hemolysis, complement activation, and thrombogenicity testing, if not otherwise addressed during the risk assessment process. For device having direct contact with circulating blood, regardless of contact duration, we recommended that you consider only hemolysis testing as a complement activations and in vivo thrombogenicity testing are generally not needed for indirect blood contacting device. Where a risk assessment has determined that hemocompatibility testing is not necessary, we recommend that you provide a summary of the assessment that supports waiving these specific tests. For example, to support waiving thrombogenicity testing, the materials used in formulation and processing, as well as the geometry of the device, should be compared to a legally marketed device with similar blood contacting duration and an acceptable history of use. Thank you, Father.
Which is the answer?
A answer. No, B. B answer.
See, A speaks about indirect, right?
Indirect only hemolysis testing.
Indirect is?
Only
For devices having indirect consulted blood reservoir, we recommend that you consider only hemolysis testing, not both. They are asking the
In
questions and they are
hemolysis testing.
hemolysis and thrombogenicity
Mm.
testing. But here they are saying only
hemolysis testing.
Hemolysis testing.
Indirect.
And thrombogenicity testing is not needed. Again, they are saying it's not needed. They are asking where, in which case both are needed. Okay. Okay, where a risk assessment has to determine that hemolysis testing is not necessary, we recommend that you provide a summary of the waiving these specific tests. For example, to support waiving hemolysis testing, the materials used in formulation and processing as well as the immunity of the device should be compared to a legally marketed device with similar blood contacting duration and an acceptable history of use. What do you say?
Indirect contact not needed for thrombogenicity.
See, this one says generally not needed. Which one? Both not needed, right?
Option.
Both hemolysis and thrombogenicity testing are generally not needed for the indirect blood transfusion. But here they are saying Only hemolysis testing means hemolysis testing is needed, right?
Yes, Father.
Yeah.
So this is contradicting. It
Yes.
says not needed, both not needed. First option says both
Both
testing
not
not
needed.
needed.
But in the text says
One is needed.
carbogens.
Correct.
Okay.
Yes, Father.
So that cannot be right,
Yes.
right?
B is the answer. It is the
Can be waived through comparison to a similar legally marketed device.
For example, it is written the support
For
waiving
example, means
carbogens.
the guidelines inform us that hemolysis testing and thrombolysis testing can be waived when there is a risk assessment test is done. Where a risk assessment has determined that hemolysis testing is not necessary, we recommend that you provide a summary of the assessment that supports waiving these specific tests. Waiving these, do you have a clue here? Tests.
Yes, ma'am.
Tests plural.
Okay.
This is, if you don't get, I'll show mass here. I'll play mass here. This is 0, not needed. Correct? Do you understand?
Not
Yes.
needed for
This one
thrombogenicity and needed for
both are not
hemolysis.
needed. This option says both not needed. Both the testing for indirect blood posing. This one says this can both tests can be waived through comparison of similar legal marketed device. This is speaking about 2 tests. Sorry. How to waive 2 tests? Do you get it?
Yes.
Are always redundant for the direct blood contacting devices. Both the tests are always redundant for the, so elimination, this one absolute is there already eliminated, right?
Yes, Father.
Now, if you want to gamify it, first one speaks 0. Both the tests are not needed. Second one says both the tests can be waived. If you have already done a risk assessment, you can waive it, comparing it to a legally marketed device. You can waive means you can give up. You need not do the test. Do you get it?
Yes.
No? See, first sentence speaks about direct contact with circulating blood. Okay. It is recommended that you consider hemolysis, completion activation, and thrombolysis testing. For direct contact alone. For indirect contact, only one. For direct contact, 2. For indirect contact, only one. Okay. Here they are not speaking about direct. In direct contact, they are saying always redundant for the direct blood contact devices. Means not required. But in the first sentence, they are saying for direct contact with the circulating blood, it is recommended that you consider hemolysis, completion activation, and thrombogenicity testing. Both you consider. Okay?
Yes, Father.
Do you get me?
Yeah.
Yes, Father.
First, C option is saying both the testings are always redundant for the direct blood. Means not required. But the topic sentence says it is required. Both are required. So opposite. C is opposite. Even otherwise, absolute is there. And first one is saying both are not needed for indirect blood transfusion. But text says.
But text says one test is required.
Yeah. Text says only hemolysis testing. So this is also opposite, right?
Yes. Opposite.
Both are not needed, is saying. So ultimately, B is left. B says that informs them if you have done a risk assessment clearly, don't worry. You can waive these tests, but just make a comparison with the legally marketed device. Is it clear?
Yes, Father.
Yes.
Yes.
Yes. That requires little competency as regards your language. This is also a exception-based question. If when you understand those both things together, it will be easy for you. General rules is explained. General rule first is explained. General rule second is explained. And then exception is explained. What is here? General rule, accountability testing, recommended. Okay. General rule 1, devices having direct contact with circulating blood, it is recommended that you consider hemolysis, complete activation, and thrombogenesis testing, both the testing. General rule 2, device having indirect contact with blood, one test. Exception, where a risk assessment has been determined that hemolysis testing is not necessary, we recommend that you provide a summary of the assessment that supports waiving these specific tests. Then example is given for that exception. We call it exception-based question. Beginners, don't worry, okay, we will be explaining it later. That also helps you to understand this particular question is this type, so answer will be this. Not the general rule 1 or 2, but last exception. Any doubt?
No, Father.
It looks nice, right?
Yes,
PPT
Father.
looks nice, right? But it takes time, okay? It takes time to create all these boxes. Okay. Yes. Do you have stamina?
Yes, Father.
This guideline extract says this all from sample 2. Okay. Thank you, OET, for allowing me to use this for
Guidelines, nurse in charge.
Nurse in charge.
Extract says
The
that
nurse in charge.
nurse in charge
Must supervise.
must supervise the opening of the
Must
controlled
supervise.
drug cupboard. Should
Must.
make sure that
Make
all
sure.
ward cupboard. What is the first one?
Please
A, option A,
the
must or
Must.
supervise?
Must.
Must supervise. Second one,
All
should make sure that
Cupboard
all ward cupboard keys are kept together.
Only.
word cupboard keys. All cupboard
What is
keys
all?
is
absolute, Father.
Absolute.
absolute.
You can eliminate.
Yeah.
Can delete.
Oh, sorry, I'm sorry.
Delete.
There was some problem. Sorry. Yes.
Can
Yes.
delete.
Can delegate
Can
responsibility. Can delegate.
Delegate.
Okay. So just read medicine cupboard keys.
Medicine cupboard keys. The keys for the control drug cupboard are the responsibility of the nurse in charge. They may pass to a registered nurse in order for them to carry out their duties and return to the nurse in charge. If the keys for the controlled drug cupboard go missing, the locks must be changed, the pharmacy informed, and an incidents form completed. The controlled drug cupboard keys should be kept separately from the main body of the keys. Apart from exceptional circumstances, the keys should not leave the ward or department. If necessary, the nurse in charge should arrange for the keys be held on neighboring ward or the department by nurse in charge.
So, which is the option?
Answer C is answer correct.
They may be passed to a registered nurse. What does it mean? Can delegate, right?
Also delegate.
Delegate.
Same meaning. And
Yes.
apart from the exceptional circumstance, the keys should not leave the ward or department. Means there is exceptions. This is the general rule. The keys for the controlled drug cupboard are the responsibility of the nurse in charge is the general rule.
Mm.
But apart from in exceptional circumstances, that is the exception. It should be kept this your duty, but then in exceptional cases, you can pass it on. Should not leave the ward, but then arrange for the keys to be held in a neighboring ward. Exception. So what is the answer?
Can delegate the responsibility of
For the cupboard keys to another ward. It's repeatedly mentioned. In the beginning itself, you have must supervise the opening of the control drug board. Doesn't speak anything, right?
No, Father.
Nothing is spoken about opening.
Must be changed like
Okay.
that only, not opening the cupboard.
Okay. So that is it. So clean. Okay. Apart from exceptional circumstances, I don't want to explain that. Exceptions. So, okay, when seeking consent for a postmortem examination, it is necessary to from the same material. Okay. Why I am showing you this? See, time management becomes so easy when you can eliminate one or two options, right? Then it's easy to find out. Yeah. Now, when seeking consent for a postmortem examination, it is necessary to.
Consent.
Necessary to.
Examination.
It is necessary.
Necessary.
Necessary means
Option A, give a valid reason for conducting it.
Valid
Valid
reason.
reason.
Okay.
Allow all
Allow
All the
all
relatives.
Relatives, all
all is an absolute.
absolute.
eliminated.
only assumption is A.
Only raise the subject after her death has occurred.
Absolute.
Only is an absolute.
Elimination.
See, these are from official materials, okay. Then you say you
Yes.
don't have time. Do you need to read now?
No.
No.
No need to read. Correct answer is this because both have absolute, that must be eliminated. But when you're practicing, don't do that, okay? Practice and find out. Okay. See, if at all you have to read, go back, complete your exam within 30 minutes, then you have for 15 minutes left, then you come back if you want to read. Enjoy reading. Let's read anyhow. Okay. Sorry. Yes.
Postmortem.
Okay.
Postmortem consent.
Postmortem consent.
A senior member of the clinical team, preferably the consultant in charge of the care, should raise the possibility of a postmortem examination with the most appropriate person to give consent. The person consenting will need an explanation of the reason for the postmortem examination and what it hopes to achieve. The first approach should be made as soon as it is apparent that a postmortem examination may be desirable, as there is no need to wait until the patient has died. Many relatives are more prepared for the consenting procedure if they have had time to think about it beforehand. Thank you.
Many ladies are more prepared for the consenting procedure if they have had time to think about it beforehand. So, which is the answer?
Wait.
Need an explanation for the reasons for the postmortem. Give a valid reason for conducting the postmortem. Option A. And there is no need to wait until the death. Opposite of? Only raise the subject after death has occurred. Opposite. Allow all relatives. It says more. Raise the possibility of a postmortem examination with the most appropriate person to give consent, not all the relatives. Opposite, right?
Yes.
Even otherwise, we have already eliminated it. Both opposites. This is from the official OET website, okay? But then people struggle reading, not understanding, then confusing, then writing third option, second option as the right answer. I've got so many. Once you fill the self-assessment forms, we can see how they select B, how they select C. Okay. Even from a general knowledge, you know, this is not allowed, right? Allow all relatives the opportunity to decline it. Call all people from UK, America, Netherlands, Nigeria, all the relatives to give consent. And only raise the subject after death has occurred. If you have to donate organs, can you do that? No. So maybe with this we will close. The manual informs us that the blood pressure monitor A is likely to manual
Blood pressure
Blood pressure monitor.
blood pressure monitor Yes.
Yes.
A, option A is likely to interfere with the operation of the other medical equipment.
Other
Other
medical
medical
equipment.
Medical equipment
Okay.
likely to interfere.
may not work
May-
correctly.
May not
May not
work
work.
correctly.
May not work correctly.
Other devices.
Other
Other
devices.
devices that interfere
Should be considered.
should be considered safe.
All hospital.
All
All
hospital
hospital. I mean, all is an
Or
absolute.
all is absolute. And that is gone. Then you have only two. Okay, instruction manual, digital automatic blood pressure monitor, and electromagnetic compatibility. Just read.
With the increased
Electromagnetic compatibility. Electromagnetic compatibility. With the increased use of portable electronic devices, medical equipment may be susceptible to electromagnetic interference. This may result in incorrect operation of the medical device and create a potentially unsafe situation. In order to regulate the equipment for EMC with the aim of preventing unsafe product situations, the EN 606112 standard defines the level of immunity to electromagnetic interference as well as maximum levels of electromagnetic emission for medical device. This medical device conforms to EN 6061-122-001 for both immunity and emissions. Nevertheless, care should be taken to avoid the use of monitor within 7 meters of cell phones or the other device generating strong electrical or electromagnetic field. Thank you.
Okay. Now, blood pressure monitor is likely to interfere with the operation of other medical equipment. Blood pressure monitor may not work correctly in close proximity to some other devices like cell phones or other devices.
May not work, may not
See,
work correctly in close.
They are saying, first one they are saying, it may, which one?
Interference.
Blood pressure monitor should be thrown away because it may interfere with other medical equipments. Second one is saying may not work, blood pressure monitor may not work correctly in close proximity to some other devices like cell phones.
Yeah, B sounds.
B.
B further.
B
Blood
further.
pressure monitor is medical equipment. Then other devices.
Again, if you want to know about the modal verb, informs.
May not.
Informing, it is not must, should, something of that sort. It's only information. It's only information. May. Okay, may. Information. May not work correctly. May not sure. Okay. Cool. This is clear?
Yes,
This here, we are not bothered about the other medical equipments, but we are bothered about other devices troubling the blood pressure monitor. Okay. Right. Maybe to make it clear, I'll just show you this. See here, blood pressure monitor. Portable electronic devices means
Other device, phone.
then the medical device means blood pressure monitor, the medical device. The article is used. Only when you use second time you can use it, saying this one. Other medical equipment we can't use the, which one we don't know, right? Then cell phones or other devices. So this option is bothered about cell phone and other devices. This one is bothered about other medical equipment, but our focus is blood pressure monitor may not work correctly in close proximity to some other devices, not other medical equipment. Usually we don't have clash between other medical equipments, right? The warning is given, cell phone should not be on when you come inside, right?
Yes.
Yeah. Again, it says care should be taken to avoid the use of the monitor within 7 meters of cell phones. Means proximity, close proximity. Synonymous is within 7 meters.
1 meter.
Okay. That's it. Cool.
I
Any
have a
comments?
question.
Yeah, please.
The A, the answer A, it's similarly to the answer B. I guess it's 50-50. Why we choose B?
See, the manual informs us that the blood pressure monitor is likely to interfere with the operation of other medical equipment. Here they are saying with the increased use of portable electronic devices. Portable electronic devices means what?
Other devices.
Cell phones.
Cell phones and other devices. Medical equipment may be susceptible to electronic interference. Which will be susceptible? Likely to?
Blood pressure.
Medical equipment.
Yeah.
This may result in incorrect operation of what? The medical device. Which is the medical device mentioned in the question stem?
Blood pressure monitor.
This may result in incorrect operation of the medical device. I did not explain about the cause and effect of the result language because beginners will be confused. This may result in incorrect operation of the medical device. It's likely to interfere with the operation of other medical equipment. May not work correctly in close proximity to some other devices. Here you see, nevertheless, care should be taken to avoid the use of the monitor. This is already compatible, but still, care should be taken to avoid the use of the monitor within 7 meters of cell phones or other devices. Some other devices.
Yeah.
Do you understand?
Yes.
Cell phones or other devices is not medical equipments, right? Some other devices.
Yes.
Generating song, electrical or electromagnetic fields.
Okay, I see.
Correct, right?
Yes, correct. Thank you for that.
You're welcome. Yes, you're welcome. Yeah, come on with your smiles. Now it is your time. Yes, anybody at YouTube, if you want to join here, I am just posting the links. I'll be just going through some of the concerns at the same time. Well, let me check out. At the same time, I will be, let me just check out. And I'll be posting the link here in the YouTube comment space. If you want to join here, anybody is welcome now. Distractions are not an issue. We will be discussing about materials and other doubts which you have asked about ebook and other things. Okay. All right. I have posted repeatedly from Edu Skills. Okay. Just check how many have the patience to stay with the practice. Right, even from the this on Zoom, many have left. Yeah. So maybe let me give some ideas about some, just I'll share just to show you some of the concerns, maybe what people asked me. I can't answer each one. That's why I put it here. What are the concerns? Somewhere I have copied this. OET Learners Corner. So please let me know how many type of questions coming in part C and please send me videos for that questions. And what time will it be in UK? That you have to find out, right? Should I find out all those details?
That's so.
Yeah?
It's in the afternoon now.
Okay, that just post those who know what is the time at UK, your countries, wherever you are. Just post after below the notice, no? So you can understand. Okay, this is okay. That is very special. And God bless you, Father. After night shifts, every day classes, however, I follow the instructions that you have taught in videos. Now I clearly find out the topic sentence and other strategies. I lost a lot of time without proper guidance. I will try to get it soon. Thank you. Means we are not able to reach. Selfishness. My father yesterday came out of the main group. Accidentally, I am quite happy with the materials available in the seed group. Also, I am watching your YouTube videos. My exam is booked next month, which was fixed before even I came across YouTube channel, your YouTube channel. I hope this practice would help me to get. See, you have started more than a decade now, nearly a decade, this training, but still there are people who don't know there is a free training like this. Whose mistake is that? Whose mistake? Good evening, Father. How are you? Next OET batch, when are you going to start? I wanted to study OET. Please help me. Thank you. IELTS and OET, which one is easier to understand? Both are easy and interesting and tasty and sweet. Okay. But health professionals never go for IELTS. Always OET is recommended for you. Just a reminder for you to add me to the OET group. Remember this. Good evening, Father. Please provide me reading materials in my WhatsApp. She will not be able to provide each one. The WhatsApp, which is in the main group, in the application, you can find in different places. Father, is there any chance for correction of my letter? I saw your expert videos. Sorry. I saw your expert videos on YouTube. It is very useful. As per your joint Telegram group, but unfortunately, I did not get any link from there. Every link is posted in the Telegram group every day by the admins. Okay. So I think at YouTube, people have joined here. I can close YouTube, right? I'm going to appear in the OET test. I would like to request that you please send me the OET related links and materials, but I have limited time and need a focused, target oriented help from you. What do you say? Everything should be sent to my personal chat. Then I will study. Otherwise, I will not study. And I have 1 week. I want everything in a nutshell. Is it possible? Thank you, Father. I am not able to open the website at all because I would like to know if you provide any personal training. Why do you need a personal training? Okay. That's not required. Every training is exactly the same. You are getting personal training, right? There is nobody inside your room. Yes. And do you have enough time to ask questions, discuss questions? That's all. Yes. Maybe at YouTube, we'll end the stream. Yes. End the stream. End. Right.